Good evening, doctors. Today we are going to do the MCQ challenge on obstetrics and gynecology. Obstetrics and gynecology is a very important subject as at least 25 to 30 MCQs come from this major subject, clinical subject. This will be very helpful for you if you are able to practice the MCQs on a regular basis so that you mark them correctly in the examination. So let us begin with the first question of Obstetrics and Gynecology MCQ challenge. Please comment in the comment box the correct answer so that it will be very beneficial for you. So let us move on to the first question. Zygote with zona pellucida reaches uterine cavity by A. 2 days, B. 4 days, C. 5 days, and D. 6 days. So what is the correct answer here? It is 4 days. Let's move to the next question. The role of human placental lactogen is A. Stimulate the milk production, B. Fetal breast development, C. Growth of the fetus, D. Endocrine regulation. What do you think is the correct answer here? The correct answer here is growth of fetus. The functions of HPL is to provide fetal nutrition by antagonizing the action of insulin in maternal circulation, breakdown of protein, fat, and transport of fatty acid and amino acids from maternal to fetal circulation. It is potent and angiogenic, helps develop fetal vasculature, promotes growth of breast for lactation. So the correct answer here is growth of fetus. Wife of a truck driver came to you with the complaint of profuse vaginal discharge since 2 days. Syndromic management will be A. Azithromycin plus metronidazole, azithromycin plus metronidazole plus fluconazole, B. Azithromycin, C. Fluconazole, D. Metronidazole plus fluconazole. In many centers, the exact etiological diagnosis of sexually transmission infection is difficult for healthcare providers. There are constraints of time and resources, increased cost, and this reduces the access to treatment. In addition, the sensitivity and specificity of commercially available tests can vary. Many countries lack the equipment and trained personnel required for etiological diagnosis of STI, sexually transmitted. To tackle this problem, a syndrome-based approach to management of sexually transmitted has been developed and promoted in various countries. The syndromic management approach is based on identification of consistent group of symptoms and easily recognized signs and provision of treatment that deal with majority of organisms responsible for producing the syndrome. Complaints of abnormal vaginal discharge is most commonly a result of a vaginal infection. It may rare be caused by STI-related cervicitis. So the correct answer here is azithromycin, metronidazole plus fluconazole. So correct answer here is A, azithromycin plus metronidazole plus fluconazole. A 50-year-old woman is diagnosed with cervical cancer. Which lymph node group would be first to be involved in metastatic spread of this disease beyond the cervix and uterus? So which lymph node will be first involved? A. Internal iliac node, B. Obturator nodes, C. External iliac nodes, D. Paracervical nodes. The main route of spread of cervical cancer include vaginal mucosa, myometrium, paracervical lymphatics, and direct extension into parametrium. The prevalence of lymph node disease correlates with the stage of malignancy. Primary node group involve the spread of cervical cancer include paracervical, that is sentinel lymph node, parametrial, obturator, hypogastric, external iliac, and sacral node, essentially in that order. Less commonly, there is involvement in the common iliac, inguinal, and para-aortic nodes. So the correct option here is paracervical nodes. Point B in the treatment of carcinoma cervix receives the following dose. This question has often been repeated. So you must know about point A also and point B also. So the point A is 2 centimeter above and 2 centimeter lateral to the external os. Paracervical parametrial lymph node involvement. It is 7,000 to 8,000 centigrade. For point B, it is 6,000 centigrade. So point B is at 2 centimeter above and 5 centimeter lateral to the external os. Obturator lymph node is involved. So it is 6,000 centigrade. A 35-year-old lady with postcoital bleeding management is a clinical examination and pap smear, B. Visual examination with Laval's iodine, C. Visual examination with acetic acid, D. Colposcopy. So what will you do here? Whenever a patient presents with postcoital bleed, clinical examination per speculum and per vaginal of cervix and vagina is mandatory. This should be followed by pap smear examination if no obvious lesion is seen. If an obvious growth is seen, then punch biopsy is required. Colposcopy and biopsy are required if the pap smear shows dysplasia. Visual examination with iodine acetic acid is inferior to pap smear and is done in places where facilities for pap smear are not available. So the correct answer here is clinical examination and pap smear. Pap smear. What is the earliest, commonest presenting feature of anterior cervical fibroid? A. Frequency of urine. B. Bleeding. C. Acute abdomen. D. Constipation. Symptoms of cervical fibroid. They are predominantly due to pressure effect on surrounding structures. Anterior cervical irritates the trigona of bladder, causing frequency of micturition. Posterior cervical fibroid, retention of urine and rectal symptoms in the form of constipation. Lateral cervical fibroid, vascular obstruction may lead to hemorrhoids and edema of leg. The ureter is pushed laterally and below the tumor. So the correct answer here is frequency of urine. During which gestational age is peak serum HCG level attained? It is between 7 to 9 weeks. Why? Why it is elevated? 7 to 9 weeks. Can anybody answer in the chat box, please? This is a homework for you. Find out why. What would be the type of presentation when the engaging diameter is mento-vertical? A. Face. B. Brow. C. Vertex. D. Breech. Well, it is brow presentation. Please click the link in the description box to join the ultimate NEET PG Breakthrough Blueprint Masterclass event. Most common cause of secondary PPH is A. Uterine inertia, B. Retained placenta, C. Episiotomy, D. Cervical tear. It is retained placenta. Fibroid causes all of the following: A. Infertility, B. Amenorrhea, C. Pelvic mass, menorrhagia. Amenorrhea is not caused by fibroid. Incidence of scar rupture in a subsequent pregnancy in case of LSCS is A 2%, B 4%, C 5%, D 8%. It is a factual question. It is 2%. Subpubic angle. Again, it is a factual question. 85 degree. Rule of Hasse is used to determine the age of fetus. It can be asked in forensic medicine also. A patient presents with CA cervix with stage 3B. Treatment of choice is A. Chemotherapy, B. Intracavitary brachytherapy, followed by external beam radiotherapy. Birthing cystectomy, short house operation. It is intracavitary brachytherapy, followed by external beam radiotherapy. Indication of acyclovir in pregnancy is disseminated herpes, chickenpox in first trimester, prophylaxis in recurrent herpes. D. All of the above. It is all of them. Human placenta is A. discoid, B. hemochoroid, C. deciduate, D. all of the above. It is all of them. Hot flushes are experienced as a result of increased noradrenaline, decreased estrogen, increased noradrenaline, decreased estrogen, increased noradrenaline and estrogen. It is increased noradrenaline and decreased estrogen. Cephalic index is biparietal diameter upon OFD, BPD upon HC, OFD upon BPD, HC upon FN. It is BPD upon OFD. In MRKH syndrome, which among the following is absent? A. Vagina, B. Breast development, C. Pubic hair development, D. Testis. It is testis. Polyspermy is inhibited by which ion? It is Ca. Maximum amniotic fluid is at A. 32 weeks, B. 34 weeks, C. 36 weeks. Fertilization usually occurs in which part of fallopian tube? Femoral end, B. Ampulla, C. Interstitium, D. Isthmus. It is ampulla. Physiologic change in leukocyte numbers in pregnancy is neutrophilic leukocytosis, lymphocytic leukocytosis, neutropenia, basophilic leukocytosis. It is neutrophilic leukocytosis. Weight of uterus at term is 900 to 1000 gram. Urinary retention earliest in pregnancy is seen at 10 weeks, 18 weeks, 22 weeks, 34 weeks. It is 10 weeks. Down syndrome is earliest diagnosed between 10 to 12 weeks. When is folic acid started in pregnancy? It is 4 weeks prior to conception. Term placenta weight to baby ratio is 1:6. Persistent occipito-posterior position is most common in which pelvis? It is android pelvis where there is persistent occipito-posterior position. Pregnant uterus will compress ureter at the pelvic brim.